took a job as an associate veterinarian in southern New Hampshire, southern Vermont, northern Massachusetts, so all those 3 states. And I am a large animal veterinarian, and I work with cows, goats, sheep, alpacas, pigs, and horses, but mainly cows. And I have a real passion for pasture-based herd management because that's where I got my start, and I just love being on pasture with cows and working with those sorts of farms. So again, that is also another reason why I'm really excited to be here. So yeah, it just feels like a full circle moment for me. So thank you for having me. So this is creating herd health protocols for your farm. And I am excited to be presenting this topic to you guys. Oh, there we go. Okay, so my objectives for this webinar are for us to define a protocol and what exactly I mean when I say that, understand the importance of planning to ensure good preventative care, so how protocols are a really important element in preventing disease in your herd and things that go wrong in your herd. We're going to discern what makes a good protocol and what we want to have in the protocol to make it effective, and how to design protocols that are fit the situation that you are looking for. And then, at this, I'm going to save actually about a half of this webinar, we're going to work on designing protocols together and practice doing a few together so that you can then go back to your farm and redevelop your own protocols or make new protocols for your own farm. Okay, so briefly, I'd like to define protocol, and I want to define it in contrast to standard operating procedure. I think those 2 words can be used interchangeably, and I think I'm fine with that, but for this webinar, we're going to just speak about protocols. I think SOPs are a subcategory of protocols in my mind, and we'll just go over the very slight difference between the 2. So protocol is a set of rules or standards that guide in the accomplishment of a specific task. And that would be, you'd use when to intervene for a calving as a sample idea for a protocol, versus a standard operating procedure is a set of written instructions that describes the step-by-step process that must be taken to perform a specific task. So a standard operating procedure is very specific. I think protocols can be very specific, or they can be more general. And a standard operating procedure is more of a step-by-step specific instructions that are for a very isolated task. So for example, preparing a cow for a vaginal exam. So you have step 1, cow gets locked up. Step 2, someone holds the tail to the side. Step 3, you clean her vulva with warm soapy water. Step 4, put on an obstetric sleeve. So very, very specific. Okay, so those are our definitions. Okay, so a good protocol. I wanted to maybe we'll take a minute here to talk about, see what you guys think of when you think of a good protocol. What if you want to say it in the chat box or shout it out. Okay, well,
it's not always as interactive as maybe sometimes you anticipate. Everybody, you would really like this to be interactive. So if you have something to add, please do.
Yes, please do. And you can throw this in the chat box at any point. But I'll just go over what I think of when I think of a good protocol. All right, so a good protocol, it's important. A good protocol will ensure a consistency of a task. So that way the task gets done the same way each time because you have very specific instructions of how to do that task. It will encourage confidence amongst employees. I think that's really valuable because what it does for employees is it tells them how to do something without them having to ask for it. And they're able to identify situations and they know exactly what to do in those situations. So I think that's really valuable for employees to, it becomes a situation where they're able to act more independently and then, think about what they're doing in the broader context of the farm. Help make appropriate decisions. This way, the protocol helps you make decisions because oh yeah, go ahead. Okay. So it will help you make appropriate decisions because you have them written down and that might describe the situation and you're then able to make a decision based on what you see. It's so important that it's a living document. A protocol from 1985 is going to be very different from a protocol in 2023 because equipment has changed, the systems on the farm has changed, the people have changed. And so whenever something gets updated on the farm, it's important to examine your protocols and make sure that your protocols are changing as well. It's really important that protocols don't go in a binder and sit on the shelf. Otherwise, I'm not sure who they're for, maybe regulatory bodies, but that's it. A good protocol is going to help you on a regular basis on your farm if you use them regularly and update them regularly. Helps you identify what needs to be addressed. So when you're looking at a situation, you can know what actually needs to happen and what the tasks are moving forward. And it'll save time. Save time because you can make decisions faster, save time because you don't need to ask anyone a question. It will streamline things that are happening on the farm. Does anyone have anything else to add?
We had in the chat that it should have precise language.
Yes, very good. We're definitely going to talk about that. Any others? All right, well, please feel free to add them to the chat box because, I will update my PowerPoint with those additions if you have them. All right, so we're talking about herd health protocols during this webinar, but there are lots of parts of the dairy farm that protocols are useful. Cow feeding, it's useful to have a sense of, how many bales you're feeding at what time, with what equipment. In the creamery, certainly, those are very important to have protocols. I would say creamery is where standard operating procedures are really crucial because you're completing very specific tasks with very specific cleaning products that need to be used and equipment. Milking procedure, I think that's another place for standard operating procedures as well, because it's like step 1, wipe off the udder with the blue towel, step 2, strip the cow, step 3, iodine dip, that's very specific step 1, step 2, step 3 kind of task on the farm. Obviously, tractor use and maintenance, pasture management, and then herd health, which is what we're going to go into today. So I encourage you to use WCA not only on health protocols, but also on the farm. All right, so now let's go deeper into designing herd health protocols. Now, I talked about how we're going to design protocols for different situations. This is how I like to structure protocols for diseases. So the way I structure those protocols is 1, I define the disease, 2, I write out the clinical signs, 3, I'm very specific about the treatment, and then 4, I like to add a line or 2 about prevention. This makes you think in the moment, how can you do better? How can you change? How can this prevent it from happening again? Okay, so yeah, like like you said, we have to be specific for these protocols. So we're going to include numerical values that are important to the situation. We're going to define the timeline for the treatment. We're going to differentiate if relevant, whether if there's differences between mild, moderate, and severe disease. We're going to include withhold information. That's the options that you don't have to look it up later, or you can save time with for regulatory bodies. Clarity on what situation you should call a vet. I think that's very important because things can spiral out of control really quickly if you're not specific about when you call for help. And name names. So use the name of the product you would like to be used. We'll talk about that in just a second. So here is an example of ketosis protocol. So here I have it defined as a metabolic disease when a cow is in negative energy balance early in lactation. And then I have clinical signs. So you're going to see a drop in milk production, decreased feed intake, decreased rumination. And I'm going to differentiate between mild and severe. So mild ketosis, you have the above signs confirmed on urine ketone strips. So I'm being very specific here as light pink or 1.2 on blood ketone meter. And then we have severe, which is the above signs, large ketones on urine strip, purple, just being very specific there, or 3.0 or above 3.0 on the blood ketone meter. And she might have neurologic signs. So treatment in this case, you're going to give 16 ounces orally of propylene glycol and 15 cc's of B complex for 3 to 5 days. Here I have the naming names of the B complex. And now I would differentiate between mild and severe. If it's severe, you're going to check for a displaced abomasum, give IV dextrose, pump with a pump mix, follow up with mild treatment the next day and continue that on. And then if neurologic, add 20 cc's of dexamethasone. And if the ketosis does not resolve in 5 days, consult the veterinarian. This is because, it could be a displaced abomasum, it could be fatty liver disease, it could be something else entirely, or ketosis is one of the signs of some other disease. And that is really important because, your protocol to sort of show what you can handle and what you feel confident about. And then after that point, you want to say, call the vet, consult with the veterinarian, because that way you can get additional information. Maybe you're not comfortable judging if a cow is neurologic and giving them dexamethasone. Maybe you're organic and you can't. So making sure you have that in there, it doesn't mean a vet's going to come. It doesn't mean that vet needs to come. It just means that you should ask for help so that you're being preventative in things becoming more severe. And then I have the lines about prevention, making sure cows have enough feed and calcium bolus at calving can prevent ketosis. So I'll just go through here. So here I have the numerical values, the timeline, putting that in there, the severity differentiation, when to call the vet, and naming names. And again, this B complex, naming that name, there's also a B12, there's also thiamine. Those are all different types of B vitamin supplements. And you want to make sure you're not giving 15 cc's of the wrong product, the wrong B vitamin product. And so it's important to put that name in there. So when your employee or when you are going to your shelf, you're grabbing the right bottle. Okay. So now moving on to designing protocols for tasks and events. So I like to design these differently because it just doesn't fit into that structure that I just showed you. So examples of tasks and events would be post-calving, calf feeding, non-ambulatory animals or down cows, vaccines. And I like to use a list format in these circumstances. So just going over the things to keep in mind for tasks and events. Again, you're going to be specific, write the amount that you're giving, the number of times that you're going to be doing something. So post-calving, you want to dip the navel 3 times. names of product. So, when you're using a cleaning product, you want to make sure you put that in there, and so that people aren't grabbing the wrong cleaning products, and that you're using the correct product. And that's when, if you change cleaning products, you should change your protocol. Anticipate scenario. So I like this. There's a lot of situations that might not be always this way, but sometimes it's this way, and putting that in there, obviously you can't anticipate every scenario, but for the ones that you can, you should put those in there. So for example, post-calving, if it's below 40 degrees, you want to apply a calf jacket, or you could put something in there, if calving on pasture, do this. And so you're going to have some scenarios that are common, but not always. You want to clarify technique that you're going to use. So when you're, for a non-ambulatory cow, transport down cow, don't just write move the cow to a safe place, right? Move the cow in a tractor bucket to a safe place, or move the cow with a sled to a safe place. And that helps you make decisions, right? That is going to make that good decisions and make sure that you're treating the animal right, and help you identify what needs to happen. When to call for help is important. So whether it's calling the vet for help or calling extra people. So you are struggling with this down cow. It says in the protocol, 3 people are required to move a down cow. That makes you not spend any time trying to move a down cow by yourself. It says, okay, 3 people, I'm not going to try and do this by myself. So it saves time, and it helps you make appropriate decisions and not do anything stupid. All right, so here's our non-ambulatory animal protocol that I like to use. And this is not an order 1, 2, 3, 4, 5, because it's not necessarily a document that is supposed to be done in a sequential order. It's just kind of a checklist. You want to make sure you're doing all of these things. And so it's important to read this before you approach a non-ambulatory animal. So you're going to perform a physical exam to determine as best you can what the underlying cause is. This will, help you make appropriate decisions. You're going to treat for potential underlying causes to help her get up, and that you'll use your disease treatment protocol list for that. And you're going to make sure the cow is sternal and in a place that she's protected from harsh weather. And this is, again, helping make you appropriate decisions that, it's pouring rain outside and you're going to try and treat this cow outside. Actually, no, make sure she is protected, and you don't have other animals in the pasture that are trying to run you down first before you perform that physical exam. And before trying to get the cow up, you want to make sure she's in sternal position. That's helping you identify what needs to be addressed. You're making sure that there's good footing underneath the cow, again, making sure what needs to be addressed. And you're going to be in a position where you can support the tail during her attempt to rise. I think this also, this does a lot of things, but it ensures consistency of the task, but it also encourages confidence amongst employees. It shows them how they can, as a human, 150-pound person, support a 1,300-pound animal. Being at the tail and making sure that there's good footing and making sure she's in sternal position can really help her get up. And it's always a confidence booster and feel good when a down cow gets up. If she needs to be moved before she's able to stand, make sure you have at least 3 people to safely use a bucket loader to transport her. And this would be very specific to your farm, whether you use a bucket loader or a sled or a sling. You do not ever want to move her with hip lifters. And you can put that in your protocol. If you have hip lifters on your farm, you don't even want people to think that that's what they're supposed to do. So again, that's helping people make appropriate decisions. Make sure she has food and water access at all times. This is, I think this is really important here because there's so many times that I go to a farm and a down cow doesn't have food and water access. And this is something that you all know that cows need access to food and water all the time, but these are stressful moments. It's sometimes difficult to get them food and water. this is, using these protocols is a helpful checklist for you to look at. You can see, did I do all of these things? I have to get on to the next task. I'm going to look at this, make sure I did everything. Oh, she doesn't have food and water. So it's there for what needs to happen, help identify what needs to be addressed. And if she's not able to rise after 12 hours of treatment, this could be 6 hours, this could be 24 hours, consult veterinarian on continuation of care. I think this is really important because with down cows, you think it's one thing, but sometimes it's another. And that might not be obvious to you. And it would be helpful. It's helpful in those moments to get outside input on what might be happening. Okay, so moving on to alternatives to or additions to written protocols. So we talked about 2 different types of protocols, herd health protocols. These would be, in place, these would be additions to written protocols, but also they could be the protocols themselves. So visual protocols are a useful addition. And I like these for calf pneumonia, calf scour. There's a really good how to identify scouring manure. And then lameness, there's a really good chart made by Alenko that has a good lameness chart. So here's the example for pneumonia. This is made by UC Davis, and it's a really well circulated chart that is very, very useful and takes sort of the question out. So it's going to give you a score. You're going to score the animal on eye discharge, nasal discharge, ear droop or head tilt, cough, breathing, and temperature. You're going to score the animal based on what you see. And then it says if the score is greater than 5, then start your pneumonia treatment. And then you'll have a written protocol. And that it could be very short because you have this visual pneumonia treatment. So this is a really nice addition. Okay, and then another alternative to written protocols is the decision tree. I like to use this in situations where there are decisions to be made at every step of the way. It's not just difference in severity. It could be, okay, this happens and then there's these options. Okay, then you pick one of those and then there's these options. And so it really helps in those situations to come to a conclusion and help you make an appropriate decision based on what needs to be addressed, because it takes you through making the decision, walks you through it. So I have these for calving or mastitis or scourment and euthanasia. So this is my decision tree for a scouring calf. And as you can see, there's 3 different severities, I guess you can say. And after you come up with those different severities, you decide which severity the animal is. There's more decisions to be made. And so in the situation of standing and vigorous, the animal might have a strong suckle reflex or has a strong suckle reflex and is happy kicking around, or it could have some sunken eyes and be slow to rise, same treatment. But in this situation, you have a weak suckle and a no suckle, even though they're both standing and weak, and there's different options. And then with these 2, you see options actually together. And so this is a lot easier to do on a decision tree rather than written down. I see there's something in the chat. Is that a clarification question or comment?
It's like it was a link to one of the scoring systems that you were talking about.
Oh, great. Which one is that? Oh yeah, the UC Davis. Great. Thank you for putting that in there. Okay. All righty. So, and then I'm going to like to have some supplemental material there. And this is going to potentially be withhold charts. So if you're conventional or organic, you'd have some a chart in there that tells you your withhold dates, and that's helpful for your organic certification as well as your FARM certification. And it makes it really easy to look that stuff up without having to Google it, look at the label that might be rubbed off, or call your rep or talk to your vet. So again, this saves time. Pictures, so any sort of pictures you might want to include. With pictures and visuals, that's really helpful if you have employees that you don't speak the same language as, and so you can have protocols that, you know, are universally understandable. Materials from other sources. So I mentioned FARM. Those of you are not familiar. I think the acronym is for Farmers Assuring something management. Sorry. And it's basically a countrywide herd management organization that ensures consistency of good animal welfare and good animal health care and good care for employees. So anyway, so they have really good resources, so you might want to add one of their resources. And if you're organic, I think it's a really useful place to maybe put the substances that are not allowed, so you can have a quick reference for that. Okay. So that is the lecture portion of the webinar, and that's about halfway through. So I was happy to take any questions or comments or points of discussion that you would like to bring up. Any sort of way that folks design their protocols that might be different than this? Or additions?
Isn't different, but I liked how you really laid out like things that are like quote unquote common sense, but you don't think of when there's an emergency. So it's really smart to have that handy.
Angie Walter also has a question. She has her hand raised. Go ahead, Angie.
Hi, so my question is, you mentioned about non-ambulatory animals not using a hip lift.
Mm-hmm.
I guess I'm wondering like why, what is the reason that you're saying that?
That's a really great question. Thank you for asking it. I say that you should not use a hip lifter to move the animal, but you should certainly, it's a good idea to, hip lifters can be very useful to lift the animal up and get her to help her stand and to support her while she's trying to stand. Moving them with a hip lifter, you can do a lot of damage to them, because if they're not ready to move, you know, it's potentially going to really hurt their hips. If they're having front end issues, it's not going to be any help with their front end. And it doesn't actually help them. They're not going to walk that well with a hip lifter on, and you can do a lot more damage than benefit. You know, obviously an animal that you get up with a hip lifter and she's slightly unstable, and you're putting a small amount of support with the hip lifter, that might be okay. But in general, I think moving an animal with a hip lifter is inappropriate. But yes, getting them up, helping them get up, I do think that it is appropriate in certain circumstances.
So
Does that answer your question?
Yeah, it does. But I guess I missed then what would you use to move the animal?
Oh yeah. So the move an animal down is on a sled. There's 3 different ways I would move them. I would use a sled, so some sort of tarp that you roll them onto and drag with a tractor. You could use a tractor bucket. There's really slick ways that you can tie a cow up and sort of, you know, get her, you know, you can sort of scoop her up and push her into a tractor bucket and keep her tied from her to her head to her leg. And that is a really really efficient way to move an animal. And then using a sling, which is, I don't know if folks have seen those be used, but it basically is, it supports their entire belly, and both of their legs are through holes, and they're carried away on with a tractor by a sling. But it supports, I think it's how like helicopters move cows, if you've seen pictures of that. But yeah, that would be another appropriate way. Those are a lot more cumbersome to use. So the most accessible would be a tractor bucket or a sled.
Okay, thank you for clarifying that.
Yeah.
We had a question in the chat. Do you have any suggestions on how to make the info readily available on farm so workers do not have to head to the barn each time there is a situation?
I mean, I think, these be something that you could put a Google Doc. I was recently showed about how you can make a Google Doc a tab on your homepage. And so you'd make a protocol tab on your homepage, and maybe it's a folder of protocols. And so you have different, milking routine, tractor management, pasture, SOPs, herd health SOPs, and that would be on your phone. And I think making it a Google Doc makes it very easily editable versus a printout version, which, you don't want to find the wrong one. So I think phones are a useful way to do it. I also think that posting the protocols in the places that you're using them, so not have your animal feeding protocols in the milk house, but have them in the barn, or, put the protocols next to the medical cabinet, herd health protocols next to the medical cabinet, so that it's right there, and laminate them or put them in, some sort of clear plastic to help keep them as safe as possible in a barn. So that would be my suggestions on how to make them easily accessible. But yeah.
I just want to comment here. One of that is great, and that I will do the same. But also don't forget that this like non-ambulatory, there needs to be a training before every employee at least once a year.
Yes, right, and that's where FARM regulations come in that go through making sure these protocols exist, right? Like you have to have a non-ambulatory animal protocol in order for your inspection from FARM, and including in that, you have to have the training. And so just like these protocols have to be a living document, they have to be something that you go over with your employees, or you at least have them read before they start work or before these situations happen. They're familiar with them. You think there's definitely certain protocols that it's important to have trainings on because of safety, right? Moving a non-ambulatory animal is a huge safety issue. Euthanasia is also another one that FARM requires a training on, and that's again a huge safety issue. So, I think all of them should require trainings, and all of them should require you discussing them with your employer or discussing them with your employees, because again, if we're familiar with them, it's going to ensure consistency of a task, and it's going to benefit the whole farm. All right. Well, if there's any more questions, please shout them out. But I wanted to make some protocols together. So what I'm going to do is I'm going to X out of the presentation mode, and we're going to type these up together. So feel free to write in the chat box what the answers to these. And yeah, we'll make this together. So milk fever, this is, you know, common. I would assume that almost everyone has had a milk fever cow on their farm, whether they've seen one or not. It definitely exists, and you will see one. So what would the definition of that be? Does anyone want to shout out or write in the chat box what they think of is the definition of milk fever? All right, well, I'll move this along with what I think of as the definition, and I think I'm gonna do this in black print.
I can
You
answer
can see it
that.
a little bit better. Oh, go for it, yeah.
So my name's T and Spicer. I work on the Sutlej Dairy Farm. And basically it's hypercalcemia, which is when they take like 90% of their calcium from their bones and it goes into their milk, and then the first milking you milk out, and then most of the time it happens during first milking. Sometimes they nurse their calf so much that all that calcium is going to their calf, which is a good mom, but then they don't have any calcium for themselves. So organic protocol is that you call a vet, and then they,
so let's hold off on that for a second.
Oh, okay.
We're gonna just stick with the definition. Thank you.
Okay,
Yeah,
sorry about that.
hypocalcemia, and I would say, yeah, no, it's great. And I would say, just to summarize what you were saying, it's like due to a dysregulation of calcium moving through the bloodstream.
Okay.
And that would be because, you know, yeah, they are getting it from their bones, and there's all sorts of signaling issues that are going on at that time, potentially.
Sure.
Do we have any in the chat? Low on calcium, balance of calcium, right? The dysregulation of calcium. So folks are familiar with that. Okay, and another thing that you said was that it happens directly after calving. So
Yes.
typically directly after calving, and we'll put a little timeline in there, 0 to 3 days, because definitely see it not necessarily on the first day. And let's see. Yeah, anything else folks would like to add to the definition?
You mean
You know,
as it presents, or just more of like the clinical definition?
just the definition. Something that I want, you know, folks who have jerseys, I'm sure you've seen milk fever at various different times of their lactation, right? It's not just right after calving. So that's why I wrote typically. So let's also say, but this can occur other times in lactation, especially in Jersey cows. And then I also wanted to write that maybe some things to think about when you're looking at a down cow. Oh, she has milk fever. Like, oh, she's right after calving, she has milk fever. But I think many of us probably know that there could be other diseases that she could have, like trauma or toxic mastitis or phosphorus deficiency. So I might add in here, because I wasn't sure where else you would put it, but make sure to rule out other down cow diseases. Say that. Okay, great. So folks feel good about that definition? Any additions? Just sort of like very baseline when you're thinking of milk fever. Gives you a good definition. Okay, so clinical signs. Let's go for that. What do people got?
The cow can't get up. Cow's down.
Okay. What else?
We have lethargic in the chat.
Lethargic.
Your
Okay.
ears are cold.
Ears are cold. Can there be a cow that's standing that has milk fever? What are some signs of a standing? Yes, the answer is yes. What are some signs of a standing cow that you're like, uh-oh, I'm suspecting milk fever with her?
Like droopy ears.
Yeah, I would say droopy. Yep, ears are cold and droopy. I'll sometimes see muscle twitching, right? I also think a cow that doesn't like go after her grain too, but just sort of looks a little vacant. Right, so lethargic and depressed. You know, something that someone told me and I was like, that's not true, but he was like, yeah, this is definitely true. Is another veterinarian is like, when they stick their tongues out, when they do that weird tongue sticking out, I think it's a stress response, but often those cows are suspect hypocalcemia, so looking distressed.
We have sunken eyes in the chat too.
Yeah, and I think that one is, you know, our sick cow. I wouldn't necessarily put that specifically for milk fever, but I think sunken eyes, I think they can also be very bright-eyed. So I'm gonna maybe write plus minus sunken eyes. Okay, now do we want to differentiate? So this would severity. So this would obviously be your severe cow. And this would be, so maybe cow with above signs, but still standing would be your old case, right? Okay, I'm not gonna have enough room, so maybe I'll just do this. So that would differentiate with severity. And then there's the extremely hypocalcemic cows that are like down and so they're lateral and bloated. This is very severe. Okay, so here we have, we've come up with the clinical signs and we've differentiated severity. Obviously, I would neaten this up a little bit for, you know, for printing. Okay, so treatment. What is the treatment?
Calcium, oral, or intravenously?
Okay, so for mild cases, I think that's a really good differentiation in this when you good time to differentiate. Mild case, she just needs oral calcium. So if he's standing looking a little twitchy, make sure, so give oral calcium. Okay, let's be specific here. Who has a brand that they like to use? Shout it out. I don't.
Bovicalc.
Yeah, Bovicalc. Give oral calcium, Bovicalc, and repeat in 12 hours. That would be one of these situations. Shaky, I'm making sure to give her a second one. Okay, so that gives us a timeline, right? Okay, severe, give, what is the type of calcium we would give IV? What's the product?
Calcium 21% or CMPK?
Yeah. Okay, so we're going to give 23% calcium gluconate as a specific product. And how many cc's? They come in 500 ml IV. Okay. And then I would say in those situations, follow up with oral calcium, follow up with Bovicalc, that would be my treatment. What should we put in here? What else should we put in here?
Yeah, asked about a bolus in the chat.
A bolus. So bolus would be a calcium bolus, right? So Bovacalc is an example of a bolus. There are products made by IBA that are boluses, and that's a whole different topic. And I won't go into depth with that right now because we don't have a lot of time. But an oral bolus would be a one of those big calcium pills, or one of those calcium gels. So, okay, what else do we want in our protocols? We have a timeline, we have numbers in here, we have differentiating severity, we're being precise as possible. All right, well, when do we want to call the vet, right? Because down cows are definitely a situation where the vet is often involved. Because milk fever, again, like I said, could be, if the cow is still down after 6 or 12 hours and she doesn't respond to this IV calcium, there might be something else wrong with her. So we're going to, if the cow does not rise in 6 to 12 hours, depending on the time of day. Like if it's mid-afternoon, you're going to want to call the vet before emergency hours start. But if it's in the morning, maybe you could wait until the afternoon. So if the cow does not rise in 6 to 12 hours, call veterinarian. Okay. So then let's move on to prevention. What's folks' knowledge about preventing milk fever?
We have diet in the chat and make sure food and water are available.
Yeah, so have good post-calving care, right? Sure, proper dry cow nutrition, and so that's like limiting calcium in their pre-fresh diet, limiting potassium in their pre-fresh diet. That's probably the most important thing. Okay, ensure proper dry cow nutrition. And then I would say, for me, it's my opinion that every single fresh cow that is not a heifer, so grade 2 or more lactation, should get a calcium pill at calving. So because it's, they are struggling with calcium regulation during that time, and it will be very helpful to give them a boost. And there's something called subclinical hypocalcemia that, a lot more cows than we think of actually are hypocalcemic, and we just don't see it with the clinical signs. So it's helpful to give every cow a calcium bolus.
We had a question about using supplements in the water before calving.
Yeah, they do that in New Zealand. I'm not very familiar with that, but they definitely do that in New Zealand. And be specific here. Okay, so that's our milk fever protocol. And that would be, and this would be very farm specific, right? And so you would choose which calcium you use, which calcium product you would use, how many hours that you're comfortable with before calling the vet. Maybe you can't give an IV. Maybe that's when you call the vet, is when you have to give an IV, and that is okay. There's also under the skin calcium. Maybe that's your method of giving calcium, and you're going to want to differentiate that on your protocol. Any questions about that?
Yeah, did we mention anything about like giving them sugar or like dextrose?
Yeah, that is something that's commonly done. Hasn't my protocol, and there hasn't been a lot of evidence that giving dextrose at that time helps. And actually, it's possible that it can hurt because dextrose, they might be hyperglycemic at that moment because they're very stressed out. And so you might actually be giving them a hyperglycemic shock moment by giving them dextrose. It's not, the mainstay of treatment is calcium, but I would say it's very important to discuss these protocols with your veterinarian. And they might say, actually, on your farm, you should do this, or, I like this. So these also should be constructed in concert with your veterinarian based on the products that they have, what they, find to be effective, because they're going to be the ones responding to the emergencies, and they're going to say, well, what have you already done? And you're going to say, well, I followed this protocol that we made together. So you're made sure that you're doing the things the way that they want things to be done.
We had a question of asking if does keeping them in shade help if they're out on pasture, or does direct sun hurt?
Well, certainly on a hot day, direct sun hurts. No doubt. You do not want these cows to be heat stressed. So, moving a non-ambulatory cow to a place where they're outside of harsh weather conditions, and in my opinion, harsh, sunlight on a hot day is certainly, even sunlight on a 70-degree day can cause heat stress. I saw a cow the other day that was a 104.7 temperature, and nothing else was wrong with, they were laying, they weren't able to walk around or sort of in the sun. And they had a 104 temperature, and it had nothing to do with anything else except for being out in the sun. So I don't think we have time for going over any other protocols, but I guess I did want to show you this euthanasia decision tree. This is put out by FARM, and I think it's a really, really, really great decision tree, and it's really helpful to make the really hard decisions on your farm. I was on a farm the other day where a cow had listeria, and we were debating about whether to treat the cow for listeria, and they brought this out, and we went through it together, and we came up with the decision to euthanize the animal. And so, this is like a good supplemental material that you don't have to come up with this on your own. Don't reinvent the wheel. This already exists and is very applicable to every farm. So, is the animal experiencing pain or suffering? Okay, yes or no. Let's say she's not. Is she suffering from any of the listed conditions below? And the print is too small, but you can just Google FARM. Maybe someone can put this link in the chat box. FARM euthanasia decision tree, and the the different diseases or conditions are listed below. Okay, yes, she is. Okay, consider euthanasia or consult with your veterinarian. No, has she been non-ambulatory for 24 hours or more? Yes or no. So at each stage of the process, you have to make a decision, and when you make a decision, you get taken to another step. And so that's where a decision tree is really useful. And you can make one that's specific to your farm, or talk about your own euthanasia methods, and I like this because it gives a definition of pain. So, is the animal in pain? You have to figure that out, and so helps you define that. So this is a great example of a decision tree that uses multiple different elements as a part of it, as a part of the protocol. All right, well, that brings us to time. If anyone has any additional questions or thoughts, please, I'd love to hear any feedback folks have to say, or contact me later. Yeah, and also if you'd like to contact me, I can write my email address as well.
What about soil samples and testing like samples on your fields? Would that make a good prevention protocol?
I think, yeah, and that's a prevention for a lot of different things, right? In terms of milk fever, I think ensuring it's hard to necessarily scientifically connect mineral deficiencies in cows and mineral deficiencies in the soil, but obviously there is a connection there. If you don't have phosphorus, well, you're going to have phosphorus in your cow. But, you know, knowing what your soils are testing at, what your forages are testing at, and what your cow is testing at, you know, in terms of selenium, like, are you getting enough selenium into them? And sometimes that's a canary in the coal mine in terms of indicative of what other mineral imbalances you might have. So yeah, I think that would be a really good preventative measure for a lot of different diseases, because a lot of these diseases are, you know, if they have poor mineral balance, they're not going to be able to be very fertile.
Mm-hmm. So the hardest thing for us to distinguish whether it's protocol is whether it's grass tetany or hypocalcemia.
Yeah.
So
That's
what's
really
the
great.
Yeah.
That's a really great question. So I think having a grass tetany protocol is really important, and having in your milk fever, like in your milk fever protocol, make sure it's not grass tetany, or you can create a fresh cow down protocol, right? Where you actually systematically go through, okay, you're treating them for calcium, you're treating them for phosphorus, you're treating them for grass tetany. There's some subtle differences between a grass tetany animal and a calcium animal. Certainly a neurologic paddling down lateral cow is going to be grass tetany. So you would sort of cover your bases, I think. Oftentimes with a milk fever cow, when I treat them, I will pump them and I give them Epsom salts, and Epsom salts is a really great way to get magnesium into them. And in fact, I would, again, like you give a calcium bolus to every single fresh cow, you'd give Epsom salts in there. Like, you know, you bring them a bucket of warm water, put Epsom salts in there. So I think especially on a pasture-based operation, which all of you are, putting a grass tetany line or covering your grass tetany base when you're treating your down cow is really important. So yeah, I think that's a great addition. You can also, if they are neurologic, you can give them an enema. So like up their butt, put the Epsom salts up their butt, and that has faster absorption. So you would do, you know, a solution of Epsom salts, 1 cup of Epsom salts, and put it rectally.
All right. Well, we're at time. Yeah, thanks, Jan. That was a great question. Thank you so much, Dayna, for your time. And did you want to put your email in the chat? So if anyone has any questions, oh, it's right there. Never mind. I see it. So yeah, thank you. And thank you everybody for coming today. And this has been recorded. So if you know somebody who wanted to make it but couldn't, we'll have access to that once we're finished. So, okay. All right.
Thanks,
Thanks,
you guys.
everybody.
I really appreciated doing this talk.
Thank you so much, Dayna.
Yeah, my pleasure. What do you guys think?
I thought it was great. Lots of good feedback and questions.
Yeah.
Yeah.
And really useful.
Great. Yeah, really useful.
Cool. I'm glad. Yeah. If you guys have any feedback that you get, please let me know. This is a webinar that I've been wanting to do, but you know, it's my first time actually presenting on it. So I'd love to keep on doing it and refine it as I go along. So. Oh,
that's great. And this is recorded. So we will have this recording available on our website for any mentors and apprentices that couldn't attend in person today. So if they have questions, we'll let them know how to get in touch with you.
Very good. Very good. Thank you so much. And yeah, if there's any future webinar topics you guys have an interest in, let me know.
Oh, we'll definitely take you up on that.
Yeah.
Great.
All right. Thanks so much. Bye-bye.
Bye.